Standing before you is Thobile Tshabalala from the Department of Correctional Services. I'm the Operational Manager Health. Coming from the department, TCS is a closed community where you find as your offenders or your inmates rather. They are staying there, some for short term, some for long term. But there are common things that you will find that are happening within the community. As I have said, it is a closed community. When we look into their health matters, starting from the time they are being admitted in the center, we are looking into the matter of being screened. We screen them for TB, we screen them for STIs. On their admission, when they're being incarcerated, when they consult during campaigns, and then we also screen them every 6 months. Even though when they are released, we still screen them. Then if it happens that the patient presents himself or herself with the signs of TB, then we do GN-expect, where we are taking the sputum, we check if the patient has TB. Then from there we move, we isolate the patient, we tell the patient the reasons why he must take the treatment, and we start the patient right there on the spot. And then we need to go back to the cell where the patient was identified, and then we do the screening. Those people, we call them contacts. Then we do the screening of those people, those who identify as the people who have signs of TB. We also do check the sputum, of course. Then we check also if they do present with TB. Then we treat if the results are positive. That is when we speak about our TB patients in the center. The TB will always be found there and there. Reason being, the correctional services in South Africa are always overcrowded. Number two, there's limited ventilation. And then with that in mind, remember they're coming in and out. So they will come and have this TB, then be treated, and the other one will come and also come with his or her TB. And then so that cycle will keep on going in and out. Yes, and then with the TB, with the HIV, the patients that are coming out and they find themselves that they're HIV positive, we start them, we test and we treat. There is no delay with the waiting, there is no waiting period. As long as the patient is ready, we test and then we treat the patient. ARVs are always available, we give it to them. Then the bloods, obviously, they have to be drawn and see the baseline. If they're fine, the relevant drugs are given. If there's a need for the changing of the regimen, it is done. We do have doctors that are coming time and again to check if we're doing the right thing. So those are the patients with the ARVs. We don't have a high rate of defaulters. Basically, it's very rare that you have a defaulter because of the automatic dot system. We do give our patients the medication, the peer supporters in the cells, so it's easy to monitor the patients that are not taking treatment. The patients themselves, or the inmates rather, they're afraid of others that are not drinking medication. So time and again, they'll report if there's an inmate who's not drinking his or her medication because they're afraid of getting sick themselves. And then coming into STI, we are not allowed, inmates are not allowed to have sex because it's not at home where you are at the comfort of your house. But we cannot run away from the fact that we do have scenarios where people are sleeping with one another. Men to men, we also do have females who sleep with one another. So we cannot not give condoms. So we do have strategic places where we leave condoms for them to access them. Reason being, as much as it is not allowed, we know they will do it. So rather be safe than sorry. So we do give health education that even if you find yourself doing it, be safe, take this. Yeah? Then at the end of the day, everyone is safe if you do so. And then we open doors. If you happen to be raped, we have a PEP, where when you have been exposed to rape, you can come to the clinic, we give you prophylactic treatment, we make a follow-up until we are sure if you're negative or positive. So being in the system where it is closed, it's easier to manage. Then with the TB patients, when they come from outside, being referred by the Department of Health, let's say for instance an offender is being arrested whilst on TB treatment, you just check and see which clinic is he coming from. Then you make a follow-up from there. You inform the clinic so that he will not be a loss to follow that side. You treat the patient, Then if he's done, you inform as well the patient that you must go back and hand over yourself to that clinic so that they will know that you have finished your treatment. And then that is how it works. So usually it is difficult, it's not difficult for us to have address, because the patient will always have a correct address, because the structure or the system that is working in the prison, it deals with the correct address. So it's very rare that we'll have the laws to follow. When we release the patient, we know very well where is the patient going and the nearest clinic. As for the rest, yes, thank you.